Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro, bringing you Technique Tuesday. And we are continuing our theme on hip or sacroiliac joint pain. The last few weeks we've done sacroiliac or hip pain that was responding to extension. These several videos we're focusing on the pain that's responding to flexion. I've already done two versions, one where you're lying on your back and you pull your knee up, another one where you're leaning against the wall and pulling your knee up. If either of those two are working, don't try this. There's no need to do it. If it wasn't working, that either means you weren't getting full resolution of symptoms after having done it for several days, or it just wasn't helping at all. Give this version, alternative, a try. Sometimes you do need to do, this is a force progression, so sometimes you need to, if you were getting the joint to end range and you're not getting the relief you need, we want to try a force progression. So for this particular one, let's say, I'll do it with both legs just to show different angles, but so hip pain is likely to manifest here. Sacroiliac joint pain is going to be here. If it's here, it might be hip. Could more likely be low back, but work with your physical therapist or doctor to sort that out. Okay, so this is going to be repeated hip flexion, but your foot is going to be up on a chair. This is, I would like this to be a little bit higher. Again, we're trying to get to end range hip flexion. Okay, so for this particular case, I'm just going to drop down into hip flexion. I'm loaded here. What I would do, if I'm standing upright here, I'm not going to get into end range hip flexion, so because of how the height of this table, I'm actually going to have to back up here. That's going to make it more easy for me to get into end range hip flexion. Remember, end range is where the magic happens. So I drop straight down, 1, I drop into it, 2, 3, I said straight down, I'm kind of going at this angle, 4, pressure on, pressure off, pressure on, pressure off. We're going to do 10 to 15 reps every 3 to 4 hours, so 5 to 6 times a day. Getting to end range, that's key here. I'll show the other side just to give it a little different angle. So I would normally be kind of like this, but because this is a little lower for me, I'm going to back my foot up. That way I'm going to get to end range hip flexion easier. Okay, so hip flexion is when the knee is coming toward the chest. Here I am, I drop in, pressure on, pressure off, pressure on, pressure off, pressure on, pressure off. 10 to 15 reps every 3 to 4 hours, making sure to get to end range, or 5 to 6 times a day. As I've said, with a lot of these exercises, the first few reps, they might feel a little uncomfortable, or you might feel the joints restricted, but as you go, it tends to become easier and feel better, and your symptoms hopefully are better after you've done the exercise. Okay? So repeated hip flexion with your foot on a table or a chair. All right? Like the video, like us on, well, that's it. Like the video, like us on Facebook, ask questions in the comments below. If you have questions about this particular exercise or any other symptom or condition you might be having, they will get back to you. I'm Dr. Sam Schroetke here with Physical Therapy and Hand Clinic of Hillsboro. Technique Tuesday. Always check with your physical therapist or physician before doing any of these exercises. All right, thank you.